Good evening, Assalamu alaikum, and Wanakam to everyone. It's a great pleasure to welcome you all for today's webinar. I'm Dr. Wazima Atif, a lecturer of ICA and Unani consultant of ICA Wellness Center. As you all know that ICA has been providing so many guidance programs related to DHA exam preparation for Unani, Ayurveda, Siddha doctors. In that respect, today's webinar is about how to prepare for Unani DHA exam. So without any further delay, we will start the webinar. To conduct today's webinar, I would like to call Dr. Rehana Mudassir, Bachelor of Unani Medicine and Surgery, India, and Unani Consultant Physician of Dubai.
Concept also what is the concept of PCOS, what they understand by the meaning of the PCOS, and then what is the concept of rotation. So the question what they ask, like it's not specific from any system, like we have written exam, we know that this is in the syllabus only, the question will come from the question, this subject. But for Viva exam, they can ask anything from any topic, whether it's gynae, whether it's gastric, neuro, anything, whatever comes in their mind. So after you clear your DHA exam, so Viva exam, within 1 week, you will get the results. And when you clear the exam, you will get the eligibility letter. And that eligibility letter you can take and you can get the job wherever you can get the job vacancy. You can go there and show them the eligibility letter and the facility which hire you for as a TCAM Unani practitioner. They will convert your eligibility letter into the license, and then only you will get your DHA license number and you can work as a TCAM Unani practitioner. For TCAM Unani practitioner, we don't need a specific hijama therapist or hijama certificate separately for the doctors. As TCAM Unani practitioner, they are eligible to do the hijama, because mostly the like regimental therapy, which is more common in UAE, is the hijama therapy with the treatment also, but it's one of the main important regimental therapy which we use anyway. So we don't need a specific hijama this license for this. If you have TCAM Unani practitioner license, whether you have DHA or you have MOH, you are eligible to do hijama anywhere in it, like where you are working. But if a non-medical, say a physiotherapist, say a pharmacist, say anyone outside this our Unani practice wants to do the hijama, they have to do a hijama therapist separate course, and then they have to take the exam, do the exams, and once they clear the exam, they will get the license of hijama therapist only, not as a TCAM Unani practitioner, because most of the time they do got confusion, because some people believe that they need to, like, Unani doctors need a specific different license for this, for cupping. It's not like that. For Unani practitioner and a TCAM Unani practitioner, we don't need a specific hijama license. It's included in that, in DHA, which can be like it's a Viva exam, which after you complete all the data flow, they will this can be like started for Unani. So for DHA, obviously we have to start the basics, as we know, the basics for Muritabiya, Asbab Sitta Zaruriya, forms of drugs, nubs, polbaras, whatever systems, modern as well as at the Unani concept of the disease. If we talk about the gastritis, what is the gastritis in modern? What are the types of gastritis? Type A, type B. In modern, you have to treat. And then also the Unani concept of gastritis, how we treat the patient being a Unani doctor. Sometimes they'll ask the question like, any patient who is diabetic, who is taking insulin or OHA, wants to convert. He don't want to continue with the modern medication. He want to get into Unani medication. He comes to a clinic and he said that I don't want to continue with the modern medication. I want to continue with the Unani medication. What is your line of treatment? How will you start the line of treatment for the diabetic patient? How you counsel the patient to stop the medication? Either you would stop one medication and then you start your Unani medication, or what are the steps like this? The case scenario they'll make, and they'll ask the question, and then you have to accordingly answer the diagnosis and the treatment and all these things. Okay. So this is all about the DHA and MOH, how you can prepare for your exam, which exam you want to sit in, whether you want to DHA and MOH. DHA is a little bit easy because it's only YY exam, and it is like you can give an exam anywhere in your country also, don't have to come here. But if you want to prepare for the MOH, you have to do written and then YY also. This is the main criteria, like how we'll start, what are the exams, and then it starts with the coaching, how to start, what are the syllabus, like systems, common questions, like metabolic disorders, mostly common cases which we see in our clinics. And the most important, which is very common, as I told you, that in regimental therapy, hijama, very important, because most of the people here in UAE, they want hijama with the medicine also. Like if they came for the sciatica pain, you can't give only the Suranjan or any anti-inflammatory drugs or anything. They want hijama for that. And it's something which is very helpful for us also, because if we start with the eligible regimental therapy and eligible dawa also, that will help us. Yani it's a line of treatment which we start for the Unani medication. So it's in practice a lot. So you should have a good hand on hijama also. What are the main criteria, where we can do, where it's contraindicated in hijama. And this is all about the DHA and MOH, how we can conduct and what are the main basic requirement for the DHA and MOH. If you have any question, you can ask regarding the DHA and MOH. Any question? Is it clear? Okay, then comes about the what are the syllabus about that. Syllabus is the main, what are the basic requirement which we need about the Amurithibia. What are the basic components of the Amurithibia? Main important is the Mizaj, Akhlaq, Arwa, Fal. What are they? How they will arkan? You know, every concept should be clear, because basic, when we know about the Mizaj or the temperament of the person, then we can differentiate what type of disease the person has. What is the predominance of the Dumby disease? What is the predominance of the Bulgami disease? How we can differentiate normal features of a Bulgami patient, and what is the abnormal features which we can see if the Bulgami disease is present in the same. So very important, the Mizaj, Akhlaq, these basics, then forms of drugs, the Murakkab dawaiyan, Mufarrid dawaiyan, and accordingly when we start up the systems, yani according, say we have started the system of osteoarthritis, then accordingly we'll see the topics, what is the gout, what is the main cause for the gout, how will we treat, what are the investigation, what is the line of treatment, what is the regimental therapy, because we know in Unani it is all about the aklat. It's the predominance of any aklat which will lead to the disease. And if it is increased bulgum, what can be the symptom? Safra, what can be the disease? What type of disease? How we can diagnose? It's all about, like, we'll start this when we start, inshallah, the coaching. Then accordingly, I will let you know how to start with and what are the basis, how we can prepare for your exams. Uh, any question regarding this? You can ask. Any confusion? Please let me know. Okay. Um,
Thank
this is
you.
the, yes.
Thank you, Dr. Rehna Mudassir, for the valuable sharing of the DHA program.
Yes.
If there is any doubt for our doctors, you can ask. There's the better opportunities for all of you.
Yeah. Share the number, ICA number, where you can you have any doubt, you can see, you can share the doubts and questions if you have regarding the DHA and MOH exam. So very soon, inshallah, we'll start the batch. Before that, we have two batches, inshallah, and alhamdulillah, they all the got started, alhamdulillah. So, mm, anything you want to know about this DHA or anything, let me know, or you can message the WhatsApp number on the icon. They will let you know about the classes, about the course, about the duration, everything. Yeah, working experience, Dr. J.I. Yes, working experience is need. Yes, you should have at least 2 years or 3 years of 1 year. Sometimes they'll accept at least 2 years of experience in private. So it's not important that you should work in private. You can have working experience of private also. It's not important for the government. And not in government. Government is not important. It's like, yes, you can. You should have, but obviously after you complete your degree, you should have at least 2 3 years. 2 years experience is fine. I mean, when you upload all the documents for the data flow, they'll cross-check first about about all your license, about all your certificates and universities and all that, and then only own clinic is okay. Yeah, fine. Yeah, if you are registered clinic, because they'll mail. It's under the they are data flow is something which is not here, which is they are the American countries, American this company which is going to be held all these things. They will check if your clinic is registered and you have register number. Yes, they will check it whether it's present. They will check the register number. If it is registered, your clinic, then only they can accept it. Okay. पहले बहुत मोदी के झूठ को ही झूठ क्या है गोली बहुत हम इस वीडियो में राजनीति के प्रसंग पर भी आने वाले हैं सूत्रों के हवाले से पता नहीं पुराने वाले maybe you have internship for 1.5 year certification. Maybe from your country you can do it. Should be 1 year. This price should not be more than 1 year. BLS certificate is very important, and you'll get it from here also online. Also, some they are doing the BLS, and it should be authorized, registered from some center, and that you have to update, and accordingly they will check and they will let you know within 1 month. I guess it's a procedure of 1 month. Within 1 month, they will let you know about the status of your case, whether it's approved or not, and then only once you get approval from the DHA, and then you can select your dates accordingly. You can prepare for your exams. So this is about the DHA. Yes, we can try for 3 attempts. 3 attempts are there for MOH as well as for DHA. If one time you are not able to get it, you can try for another 2 times. And there are 3 attempts for both MOH as well as DHA. Yeah. If we couldn't pass in all 3 attempts, what can we do after? Age limit, there's no age limit. There's no age limit, so anyone can give exam. There's no age limit about that. This question is little bit, if we couldn't pass in 3 attempts, then I have no idea what we can do. Is that we can start like what we are practicing, we can start with this practice only in our countries, what we are doing, because after 3 attempts, I don't think they will be entertaining again. for only the limit is like 3 attempts they'll give you, and it's up to you if you want to give first attempt. After first attempt, after 2 months, yani if one attempt is not cleared, and then after 2 months you can start for the second attempt, and then after 3 or 4 months, the duration is up to you. Within 1 year, you have to complete, and 1 year is the limit. Within 1 year, you have to complete all these uh, attempts, and all the 3 attempts within 1 year. So I think in 3 attempts, not too difficult as it seems. It's very easy if you start, because Alhamdulillah, you are all practicing, you are all working, we are all experienced, Alhamdulillah. So I don't think it's not going to be too difficult for you, because it may seem sometime that it's very difficult because we have to start after completion of course and everything. When you are in practice, it's very difficult. It seems difficult actually to start from the beginning. But believe me, when we start from the beginning, this is something which is in our mind. We are practicing these things. So things will be easy, inshallah. So let's hope for best. Inshallah, things will be better. Okay. So do we need DHA license? No, I told you that we don't need any DHA license to practice hijama. We need only DHA. That is the DHA. You will get DHA, TCAM, Unani practitioner, not as a hijama therapist. So you don't need a separate practice for the hijama. Yes, if you want to practice as a hijama therapist only. For that, you can do hijama, only hijama, and then you have to do sit for the exam for MOHR DHA. Then you will get the hijama therapist license for that. But if you are a doctor, you can get the TCAM Unani practitioner license by giving you a DHA exam. Why you need practice a hijama DHA license? Okay, so basically, as I told you, that for DHA or MOH, for the Unani doctors, they don't need a separate hijama license. When you give exams, you will get the what we call the hijama is there included. You don't need specific license for that. It's better because Alhamdulillah, you have degree, you are a doctor, you get the practitioner, you get more chance. If being as a TCAM practitioner, the chances are you are working as a doctor, right? So being as a hijama therapist, if you have only did hijama and you have got the license, you are working as a hijama therapist, obviously the salary will be less. You can't do the only thing which you can do is the hijama. Got it? So it's better to work for your license. You can, inshallah. Yeah, that after 6 months work is same as MOH, can work in all 5. That's what I'm saying. I said before that when you have 6 months of, if you get the DHA, that is Dubai Health Authority exam, that you cleared that exam, you have that eligibility letter and some facility in Dubai, they hire you and you work for Dubai at least, only I'm talking about the Dubai Emirat, okay? So you work there for 6 months. After 6 months, you can convert your DHA license into MOH. This is one criteria. Okay, so you can convert. It's very easy after 6 months. But for first 6 months or 8 months, you have to work in Dubai only. You can't work in other Emirat with DHA license. You have, because it's specifically Dubai Health Authority license. So that is why you have to work there for at least for 6 months. And then only you can convert it into MOH. Okay. Then after that, yes, obviously you can work in any email. That will add your experience also in DHA. You'll get experience of DHA, then you can work in other Emirates. And don't worry, inshallah, it's very easy. It's very, maybe within 15, 20 and a half an hour, they'll ask the question. These questions are very relatable, Yani. You have seen so many like patients in your clinic. You have seen so many patients day by day. So it's very easy if you are working, if you are in practice, you know each and everything. Inshallah, things will be better. Let's hope for best, because whatever we have, Alhamdulillah, 2 batches, and whosoever sits for the exam, Alhamdulillah, they clear. It's very easy. Just you have to make up your mind that if you have planned to come to Dubai and work as a Unani practitioner, TCAM practitioner, this is all about the maybe of 2-3 months you have to prepare. You have to keep yourself motivated that yes, I am busy, I'm working. Obviously, everyone is working, everyone is practicing, so it's quite difficult. But you can have 2 hours, 3 hours in a day. You can get for yourself to study. Only the thing is that you have to revise. Nothing is going to be changed. What you have read, it's not going to be changed because in Unani it's like same. The line of treatment, medicines are same. Only you have to remind yourself what are they, how we have to start, what are the question, what are they asking, how I have to answer the question. This is how they'll see, and the presentation is very important. Okay. Uh, Inshallah, I think Dr. Wasima will let you know about the classes when we are going to start our new batch, inshallah, and she will let you know about the timing and everything. I'm looking forward, inshallah. So, my suggestion for everyone who is having this thing in your mind that we want to start this, inshallah, it's very easy. It's very good platform for all the doctors who are working. Alhamdulillah, Dr. Saja, as you all know, he got selected, inshallah, here, and he's maybe next month he's coming to Dubai to start his work here, inshallah. So things will be better for you also. So if you want to try it, I'm there. If any type of question you have, Dr. Wasima is there. Any type of you want to conduct, you can talk to her, to Aika. We can get connected and we'll let you know if you have any problem. Will they ask on Unani pharmacology? Yes, it's very important. Unani pharmacology is important because what they see, like if we tell them that about the, say, we're talking about the diabetic patient comes to you, is diabetic, and we need to treat the patient for diabetes. So we can't give DHA or insulin for them. We have to start Unani pharmacology. That is what we are about supposed to be here, right? So Unani pharmacology is there. You have to. This is the main important because the line of treatment what they ask for in the question or in practical also. Because if you are working as a TKM Unani practitioner, obviously patients will come to you for the treatment of this diabetes or any type of disease. They want the treatment from you from Unani. So yes, Unani pharmacology is very important. But you don't have to worry about all those, we have so many drugs. Don't have to worry that I have to learn all those drugs. No, very common drugs which we use in our daily life and which we give the patient. These are very like we have to answer them only those drugs which are specifically present in UAE because in UAE we don't have too much murakkab dawaiyan, yani compound drugs are very less used in UAE. Here we use mostly single drugs. So compound drugs are there, but not too much. Yani sharbat, hub, they are not used too much. But yes, we give mufrida. And the mufrid dawaiyan are available. Single drugs we can start with that. And only you can make the list of the drugs which we have to start. Like we'll see what kind of drugs, 5 or 10 or 15 drugs we have to learn for the exam. And then while they ask about the treatment, you have to give the line of treatment in Unani. Yes, that's very important because patient will come obviously for the Unani pharmacology. And don't have to worry to start to read each and everything. We will see, inshallah, how we can start. Okay. Hmm. Coaching can be for like 40, 45 days. It depends actually, 40 or 45 days. And which include the basic concept of the Moritibia. And then the systems accordingly, we will see the systems and the line of treatment and all these things, notes and PDF will be given to you. Like last time they asked the question for the doctor, like there was one question what they ask is that there is one patient who comes to the clinic and There's one patient who comes to your clinic and he has high BP and there is breathing difficulty, sweating. What is your line of treatment at the time? And her BP, when you check the patient's BP, it is 180 by 120. What is your line of treatment? So there you have to be, this question is about the model. The concept is about the modern concept that how we will treat the patient in emergencies. It's not about that we have to start the treatment like as a Unani, but only you have to see how modern, in modern medication, how what are the line of treatment we will see. Like we'll go for the ECG, we will see the cardiac markers, then only we'll start if there is any cardiac issue, and we will refer the patient to the medical unit. Any other question? Any query you have, you can ask. About the classes, Dr. Wasima will let you know when we are going to conduct the classes and what will be the timing and all. And we'll share this information. Regarding the exams, as I told you, it's not going to be very tough. It's very easy, inshallah. Once you start, you just make up your mind that we'll start from the beginning. Things will be easy, inshallah. We'll share the folder, we'll share the experience, what we have, inshallah. Things will be better. Okay? Any other question, any query?
Thank you so much, ma'am, for the brief explanation and guidance. Yes, as I told you, we are ready to guide you about the DHA coaching exam and coaching classes. If any doctors are interested to join in our classes, please WhatsApp us. We'll guide you. We are ready to guide you. And we will inform the complete details of class time, commencing date, and other procedures and all. So if you don't have any doubts to ask, we can wind up the session. And I really want to thanks again to Dr. Rehna Mudassir for valuable explanation and guidance.
Thank you, dear. Thank you. Best of luck for everyone. Okay, see you inshallah. Assalamu alaikum. Take care.
All right, Mr. Okay. Thank you so much for the other doctors also. If you have any doubts and inquiries about the class details, we can give you in the WhatsApp. Thank you.